Thanks, Kate. So my name's Sue Bale, and I just tilt this round so you can see Anna. Good
Hello.
morning. So we're really pleased to have this opportunity to speak to you this morning, to do this workshop. The timing, if timing was ever any good, I think is really good for this second wave now, because they say hindsight is a wonderful thing. And normally when you say that, it's because, you know, something's happened and you think, I wish I could go back. Well, with the second wave, we have got that opportunity now to, if not go back, be a bit more prepared for what's to come. So we wanted to share our experiences with you and to learn from your experiences in this workshop, and to have an opportunity to sort of revisit where we've been and what happened. And we wanted to tell you about an Bevan, and we put an application in for this workshop because we were hit really hard and fast by COVID at the beginning, and Newport was the hardest hit, second hardest hit outside London. So what we're going to share with you was sort of really live as it happened, our experiences. So I'm going to hand over to Anna, who's going to share a little bit about the theory of a leadership and what we've been doing.
So hi everyone, just to apologise that we've had some technical issues, so we're both on our phones today, which is why we're going back and forth quite a lot. So next slide please. So the objectives of our session today is to examine why we should all undertake a learnt lesson process, to have some personal reflections of COVID, which I've asked some staff members, and I've asked some of you delegates as well about what you felt and what you thought was important about what we should learn about COVID. And we're going to go a little bit of theory about what sort of leadership model we could use to help and manage difficult situations. And then we'll look at our own personal experience of COVID in an Bevan. And Sue will share lots of stories about that. Next slide, please. So I just thought we'd do a little bit of theory about why we should do lesson learns processes. And I think it's something that is not always done, and especially in stressful and busy periods. And reasons why it's not done sometimes is lack of time, lack of resources, and sometimes there's no incentive to do it, and we don't have clear direction on what we should be doing. But I think we should all try and put it in practice. We can acknowledge what went well and what went well and pass this on. It shouldn't always be a complaint session. We shouldn't be like focusing on all the negatives. It can be focusing on positives as well. And I think we can all, with COVID, we can easily focus on all the negatives, but there are some positive experiences that come from out of it as well. And it's not just important to go through the process, but we need to learn lessons about it and go put those into practice, because we all know that we can't afford to repeat the same mistakes, especially going into the second wave. We can acknowledge what happened and we can learn from it and reduce time and cost and effort and try and make it a more efficient process this time. Next slide, please. So I just had some feedback from people on what their personal reflections of COVID was, and it was very negative and very positive. So I just wanted to go through some ideas that you might be thinking. So the main one people said was family, and that can be positive and negative. So positive was being locked down together, spending more time together. On the other hand, a negative was spending more time together. Some people felt being in the same house all the time and having the pressures of spending all that time together. But it was important as well to acknowledge people that couldn't see other members of the family, about being apart, missing important events and milestones. I think we can all relate to that. Of course, there's other things like death, uncertainty, but then looking at some of the positives, and coming from a health board point of view, this period in time, we've learned so much, and the information technology has developed so much. So who would have thought this time last year that we'd be doing a digital conference and we'd be doing a workshop online for everybody to come and see? And I believe we've got an audience, not just from Wales for this conference, but they'll be worldwide, and that could never happen pre-COVID. So it's made us digitally advance a lot quicker than we would have done previously. We all remember going to conferences and having to book accommodation, going to hotels, taking the time out, where today you've all taken out an hour of your time, your busy schedules, and can just do the session and then go back to work. And one of the other things that people have mentioned quite a lot is pulling together, and that can be both in the community when we're having the chat for carers, and the support for the NHS, but also in work. So this presentation is testament to that, because I've had lots of people help me with it. I've had People help with the photos. We've had people put the figures in for us. So we've pulled together in lots of different ways, and Stu will mention a lot of that later when we go on to talk about the vaccine trial. Next slide, please. Okay, so we're looking at some theory behind it, and this is a model that they used a lot in military, which is now becoming really, really popular. So I have to be really careful when I say it, but it's the VUCA leadership model. And I think COVID suits this brilliantly, because it's looking at situations which are volatile. So we might know a lot about the situation, but we don't know how it's the outcome is going to be and how we're going to predict it. And it is rapid. Uncertainty. So we might know quite a lot about the situation, but we're unsure how to proceed. And that was completely true of COVID. It's really complex. So we might have to make multiple key decisions on how we're going to make these judgment calls and how we're going to do it. And it can be ambiguous. So we have lack of clarity about how it's going to go ahead. Next slide, please. So with VUCA, that was the first thing that they came about, but now recently they've developed it to then give guidance on how you interpret it. So then they've changed it now to how you deal with those uncertainties. So we have vision. So I think this is really important, knowing at the start your clear direction and what your outcomes want to be. And then knowing that will help you achieve the vision. Of understanding, so know who knows best and how to contact them, and what opportunities you can create. Clarity, to know how your organisation works, how every single person in that organisation works and how you can get the best from them, and be clear about their roles. And then agility, and we all had to have agility during COVID. We had to be really pragmatic, change what we normally did, adapt really, really quickly. I think, well, talking from our personal experience, everybody did that really, really well. People had to be moved around. They had to do things they never did before. We had to learn how to go onto COVID wards. We had to think outside the box for how we collect samples, how we did consent. So agility was really, really important during this period. So next slide, please. I'm going to hand it over to Sue now.
Yeah, so we thought we'd share with you what happened in an hour in Bev. And as I said, you know, we were hit very hard, very quickly. And before COVID happened, we had about 120 clinical trials running, and we worked really hard to get those open and recruiting. Every year we were trying to get more work happening, more patients' opportunities for different specialties. And so it was, and we had 36 new trials in the setup process. So that was a huge amount of work. And you know, we really, oh, next slide, sorry. A huge amount of work, and that meant that you know, we had to just stop that in the middle of March. It was devastating to find, you know, whilst we had a responsibility to the nation and to our population, but all of that work to sort of suddenly be halted with no idea of whether that would or wouldn't come back again. And you know, and we all know that in March, in the middle of March 2020, the UK CMOs announced a complete focus on COVID-19 trials. As we said, locally in Newport, we were really the second most affected city outside of London. So we had to move very, very quickly, and to get patients the opportunity to go into those trials. And we had to get set up really quickly. And I think that was probably a positive, that sort of rapid setup. Next slide, please. So the immediate concerns were the ability for us to set up and run the urgent public health COVID trial.
Hi, we seem to have lost them there. We'll hopefully get Atsu and Anna back soon. Just bear with us, please. And they seem to be coming back just now. There we go.
Coming back, Kate.
Yeah, excellent. Thanks, Sue.
Okay, right, I'll carry on. So the safety of our participants clearly was key whilst we were setting studies up at pace. And we had to sort of look at our staff numbers and their capacity. But also then at the same time, you know, this is what Anna was talking about, sort of these competing priorities, to think about our staff well-being and our staff safety for those staff that that needed to be shielding straight away. So we were asked, could we redeploy staff, which we did immediately with the idea that they would come back on board whenever, you know, when they needed to. And we had shielding and high risk staff. And so it was about finding them a valuable role and dealing with their frustrations and disappointment that they couldn't be in the thick of it. And of course, with social distancing, that was very new to all of us in our everyday life, and as much so in our working life as well. And we had you know, sort of like lab staff who were helping with other trials, who had to really focus on the delivery of acute critically ill patients. And whilst they had those precious services on the pressure, they were trying to help us, and they were absolutely brilliant. Pharmacy, radiology, pathology were all amazing in helping to support us. Next slide. So the senior management teams, there's just 5 of us really, implemented regular COVID-19 meetings. We were meeting probably on a daily basis, short, sharp, very focused, with a standard agenda to work through about, you know, planning the COVID trials, looking at the existing trial status and looking at what each of our staff were doing. And I'll give you some examples now shortly. Next slide. So within 24 hours, we suspended 80% of our non-COVID trials. Well, that's all we had on the books at the time. And this was prior to some of the sponsors suspending trials, because we knew that if we were to focus on COVID, we couldn't be doing that work. The remaining 20% were then under a deep review, looking at the safety concerns for patients, whether it was safer. We were working with the consultants here, the PIs, working with the consultants to see if it was safer to keep the patients in a trial or safer for them to come off a trial. And then we had to contact the PhD students and the university partners to make sure that they knew that they could not come onto the premises. And then very shortly after that, the HRA came up with some guidance on how students were to proceed. Next slide. And within 72 hours, we then suspended about 95% of those clinical trials, because we had worked with the consultants and the PIs to see that it was safer to keep those take those patients out. The 5% that we kept on were those studies that were sort of cancer trials or biologic trials where it was not safe to take the patients off those treatments. And universities, we had, obviously you can imagine, quite a lot of devastated students and supervisors who were after our support to help them and guide them for what they were to do with the PhD and master's students. And then the chief investigators and principal investigators in our organisation needed a fair amount of moral support as well, to talk them through the process, because they weren't keeping as abreast as we were as the latest developments, and things were changing sort of all the time. And then we were working with the chief investigators and principal investigators to set up the COVID studies as well. But it was a fast-moving world, and I don't think, you know, from lessons learned, we were trying to manage our daily lives. We were trying to work out what we couldn't do at home, and then there we were in work, making these sort of quite dramatic decisions, and it was very emotionally and physically tiring. So in terms of the immediate delivery team actions, next slide, sorry, and next slide, please. In terms of the immediate delivery slide, we were rapidly setting up COVID clinical trials. So this was a real positive. You know, if we think about the way that the HRA and sponsors set these trials up, I think our first trial was set up, the ASARIC trial, in 24 hours. We mustn't lose that. We absolutely mustn't lose that speed, because nobody compromised on any safety issues, and yet we were able to set studies up really, really quickly. Then when we thought about our delivery teams, it was about social distancing in teams. I don't know, Anna, if you want to say something. We decided that we would separate the various delivery teams and the management teams to keep us separated, so that if one group caught COVID and we had to suspend operations, then other teams could pick that up. I'll just swizz around a little bit,
okay.
Anna.
And yeah, the social distancing was difficult to manage with a big team. We're based here in Clyde, which is an old house. So we were based in small offices, so it was really difficult to manage. But we did it, and I think we did it quite well, because during the first wave, touch wood, nobody got COVID, and we've learned afterwards the people who have the offices upstairs actually all had COVID, and downstairs none of us caught it. So that's run by a mental health team. We didn't realise till afterwards. So our social distancing, our hand washing and hygiene must have been really, really good, because nobody here had it. So it was difficult, and to try and manage that social distancing, we tried to use different things. So one of the things that we brought in that helped with social distancing, but also helped with delivery of trials, was doing 7-day working. We quickly realised that the trials we were running, that we were taking them into specialities that never used them before, and using doctors and nurses that might not have done trials. So we realised that we needed to provide that 7-day support, and having staff working on weekends has been a positive, and I think it might be something we'd like to continue post-COVID as well. And then, of course, we identified staff, like Sue said, that needed to work from home, needed to be shielding, and all credit given to, we got somebody called Jane Jones who works here, because she was brilliant. She worked from home, but she managed to get everybody who needed laptops. She managed to get VPN connections for everybody really, really quickly. Anything we needed in terms of technology and equipment, she got us. And that just enables people to work from home. And then we have to talk about the support services as well. So they were really crucial. There's not one trial we could have done without having the support services on our side. So pharmacy, pathology, radiology, ward staff, they were all really quickly there to support us to do feasibility, and they understood how quickly we needed to set these trials up. Next slide, please.
I just wanted to say as well that what we did recognise very quickly was that the staff were very shocked to be sent home, and we were shocked to be sending them home, actually, to be truthful. And so what we did was we set up a WhatsApp group, which proved to be like fantastic. So this was, you know, live issues that they would normally be shouting across the corridor, popping into somebody's office next door. Oh, I can't get onto Red Cap. I can't get this. I can't do that. How do I do this? And that was like a live chat that really went across every day. So the staff felt connected. And then every morning at 11 o'clock, we started off having a Zoom meeting, so everybody could see each other. And then when Teams came, we changed to Teams. And I think recognising the impact of that is really important. And as you know, Anna said, we were really grateful to our pharmacy, radiology, and pathology teams, who really pulled out every stop to get us up and running. So can I have the next slide, please? Oh, sorry, just say it, can you go back? Sorry. Yeah, so the emotional impact, it was a really difficult first week. As we said, sending those staff home, learning how to support people. We did have personal losses and difficult decisions to make. So I think there were several of our team members who had parents die. Some of them were related to COVID, some weren't, but even those non-COVID deaths were in a COVID situation. So our staff couldn't go and see their parents. And you know, that was really sort of quite difficult. You know, sort of how you manage that. And I think that as time went on, we were talking on one of our on a WhatsApp, as it turned out, and one of the admin staff had said, "Oh, I'm going to open a bottle of wine tonight when I finish work, because I had my first patient survive on the ASARIC data collection study." And I thought, gosh, what, you know, I thought, you know, as a senior person in my team, what does this mean to them? And then somebody else jumped on WhatsApp and said, yes, I had somebody survive yesterday. And when we sort of talked about it and dug into it a little bit more, what was happening was that these staff were working at home, entering data about patients who might be younger than them, the same age as them, older than them. So it could be their wives, it could be their daughters, it could be their mothers, and these patients were not surviving, and that took a real impact. And there they were at home day after day entering this data. And so we paid more attention to the emotional support and emotional impact of our staff, and tried to really think very carefully about the work that we were giving them, because whilst we were all running around the hospitals and setting studies up as well, you may forget how isolating it can be, you know, whilst people are having emotional difficulties and problems at home, and yet this work is quite burdensome. So yes, it was a difficult week, and we had you know, but then the real positives. So we had a member of staff who worked on research nurse whose portfolio was looking after mental health patients in mental health studies, working in the mental health hospital. And as those studies were suspended, said, what can I do? And within 24 hours, there she was then on intensive care, supporting intensive care studies. Now, she couldn't go on to intensive care and nurse patients and put them into studies, but she was running up and down with samples, equipment and what have you, and going into a red zone and having to learn, you know, how to sort of like gear up to and protect herself with all the PPE that goes into that. And I suppose that sort of can-do attitude, mostly we had, what do you need me to do? What does it take? What can I do? And I don't think that will be any different in a second wave, and it probably hasn't been any different anywhere across Wales, but it is brilliant to see that. And the photograph that we've got showing here was taken by an ODP working in Neville Hall, who and that was one of the 100 photographs that was selected out of 32,000 in the UK to go into the National Portrait Gallery. I think it sort of says it all really about how we were probably feeling at the end of that first week. Can we have the next slide, please? So we were in the situation where we probably got our 19 COVID trials up and running towards the end of April, beginning of May. We felt as if we had some degree of control over the situation. The workforce had been deployed to the best that we could. We were at that period of time in May consistently recruiting between 40 and 50% of the total Wales population of COVID participants into trials, with a fairly small team. But you know, that's out of necessity when you're very hard hit. This, you know, we were the hardest hit across Wales to begin with. It's absolutely necessary that you do that, and we're hoping that some of these experiences we've got of doing this work can be useful to other people, you know, as they come along. And this time round, it looks like others will be hardest hit first with the second wave. But we really felt that we were looking out for trials now. We were looking for the gaps that we had for our patients and staff. And we were adjusting to that new norm. It felt completely normal to be working in the way we were working. And then we were approached to be the first site in Wales to participate in a vaccine trial. And we were invited to be one of the 18 sites in Wales to run the Oxford vaccine trial. And you sometimes ask yourself, how hard can it be? You know, we've done all this other work. Yeah. But, you know, the vaccine trials, you know, are, I suppose, amazing in that we're trying, you know, certainly Oxford and Imperial have done 6 years work in 6 months. So it's a fast moving world, but we wanted to share some of that with you as well. So taking on the trial, we had sort of a really good collaboration. Sorry, next slide, please. We had a really good collaborative working. So Health and Care Research Wales, with the comms team, with Nikki Williams, with public involvement, with primary care, admin staff, all of the staff came forward in Health and Care Research Wales to see what they could do. Like us, they were very much outside of their comfort zone on many occasions, but they were willing to come in to us, to work with us in an Iron Bevan, but also to be doing some distance working for us. But the collaboration was between public health, the clinical trials unit in Cardiff, who were helping us sort of set the study up, because you have to remember that all of these other trials, we couldn't just stop doing that activity. We had to carry that on and do this on top of it. And what we were saying to Welsh Government and Health and Care Research Wales, we want to do it, but we haven't got the capacity with such a small team with what's going on already. And we couldn't take patients out of the recovery trial or REMAP CAP or any of the other studies just because of the vaccine trial. And yet the competing priority was the vaccine trial was absolutely essential if we were going to move forward. So, so Public Health Wales, principal investigator was from Public Health Wales, the trials unit in Cardiff were there helping us set up. Health and Care Research Wales were asking all of their staff to help us. In Aneurin and Bevan, we managed to get hold of our flu vaccinators, our phlebotomists, other nurses, medical staff, junior nurses. I think Works and Estates were probably the stars. You know, we found out that we were accepted to be one of the 18 sites. We didn't have the facility, the physical facility, and yet there was an unused area just adjacent to us, and it was a complete mess, an absolute mess. Within 30 minutes, Works and Estates were there with their clipboard and their staff. What do you need doing? What's it got to look like? Within 3 hours, we had men scraping the walls off and starting to prepare and paint, so that within 2 or 3 days, that facility was ready to be kitted out. And the porter in, they were taking stuff away, bringing stuff. The cleaning staff were absolutely amazing. They got in there, they deep cleaned it, they came back on Sundays. What does it take? What will it take for you to get this sort of physical space ready to run the vaccine trial? And I think, you know, they have been really our unsung heroes and our unseen heroes. The emergency planning people and occupational health helped us with phlebotomists, and they were just amazing. And you know, that was on top of whatever all the additional things that the R&D team were doing. So the physical space for those who are going to be doing vaccine trials is something that really needs to be considered. And the national vaccine, the Wales National Vaccine Group is, I know, sort of taking on board many of our experiences and lessons learned. But I think collaborative working has just been amazing. We can't let that go. The way that we built up relationships across, all 4 of us have built relationships. We did have relationships, but I've got to say they're so much stronger for having this experience of doing the vaccine trial.
Yeah, definitely.
Yeah. Do you want to see anything more?
No, that's fine. Next slide, please.
So in terms of activity, the first patient that went into a COVID trial was on the 9th of March. And we had the first find, which was, Anna, do you want to say something about that? So this was a genetic study.
So yeah, FIND is looking at an ITU study. So we had the first COVID patient in Aneurin and Bevan on the 9th of March, and we managed to get that patient into a study on the 17th of March. So 8 days from the patient admission. And just thinking about it, these patients, we never had them before. So I think that was remarkable. And our first CTIP trial recovery, we opened on the 21st of March. Had a very tenacious nurse on board, and it was a weekend working, and she managed to actually ring the CI on his mobile, say we need to open today. He was actually on a walk at the time. He went home, opened our site, and we recruited full participants there and then. So that was good. And just some background on what we did before. So previous to COVID, we only had one ITU research nurse that worked in our health board, and considering a lot of our studies were ITU studies, all the team pulled in to try and support her. So considering that, it was remarkable that in the Royal Grant Hospital, every COVID patient got recruited into a COVID trial.
Next slide.
Next slide.
Yeah, so if we look at activity, I sort of said that we did very well because we had the patient population, and you know, we had to move really quickly. So you can see with the graph here how the numbers sort of increased as COVID. You know, we follow the profile of COVID. COVID admissions and admissions to ITU, and the disease trajectory that the rest of the nation, the rest of the UK has seen, and sort of how it built and dropped off. And I think what's great is that we've been able to manage to respond to recruit during that time. So we now know, as you know, as I said, that, you know, as of the 30th of September, we had nearly 2,500 patients recruited into COVID trials over the course of the of COVID. We provided research in areas that had never done it before, and and as Hannah said, you know, that took a fair bit of doing. And you know, we're really proud of the achievement here, but more than that, in terms of lessons learned, because that's what this workshop is all about, it's that how can you be responsive, and how can you make sure that you're going to get your patients into studies, because you know, it's really important. If you think of the impact that these trials has had, you know, SARIC, which recruited more than 22,000 patients across the UK. So you think of SARIC, which actually sort of has driven rather policy changes, and how you know, those decisions have been made. We now know that ethnicity is important, that patients with lung disease, patients who are obese, are those patients who are vulnerable to catching to catching COVID.
I'm sorry about the moving screen. We've got a technical issue.
Just need a bit more power. Yeah, we're on 4%. Okay, woo,
Yeah.
we're good to go again. Technology's not going to defeat us, I can tell you, on this session. Yeah, so I think that's probably covers off most of that. But as we move into the second wave now, we feel that we are more prepared. Can we have the next slide? Great. Right. So in terms of lessons learned, I'm going to hand back over to Anna.
I think we're going to lose our battery. I think if we lose battery, we'll come back as quick as we can. So lessons learned. So this slide is looking at what you all sent me to your common lessons learned. So my battery's going to go now. So we're looking at this slide. I asked you to all share one sentence, and these are the ones, the common feedback that I had: to be adaptable, to look after your own mental health, to have a common goal to pull people together, to expect the unexpected, and definitely the collaborative working I've talked about before. So the importance was that we all had a clear vision. We knew what we wanted to achieve, and we did achieve it. It was really rewarding to have patients going into trials that we previously wouldn't have run. Being the first site in Wales to have the vaccine trial was a big honour and a big achievement, and we're still ongoing with that, and it's a daily headache, but we are getting there, and anything after this will be easy, but we're still glad that we've done it. And I think the biggest thing was team working and the collaborative working. So working not just with the research delivery team, but working across Nair and Bevan, but also working across Wales, looking at Health and Care Research Wales, all the staff they've provided, looking at all the hospitals. We all now have contacts that we never had before. We all know people that we never worked with before. And there's going to be bigger challenges. So the biggest challenge I've got in terms of the moment delivery team is the track and trace, and then having people that have to isolate for periods of time. So that's something that didn't really impact us last time, but now looking ahead, that's something that's going to really impact my delivery team now, looking forward to the future. And everything else will just carry on like we did before. Recovery trial is completely adapting. It's not the trial it was before, it's much more complex, but my staff are really stepping up to it. I'm so grateful for everyone that's in my team. They've all done really, really well, and they've said they've all adapted to completely brand new situations and new environments.
Yeah, can I just say something about as well within the organisation? I think that everybody saw the television, and everybody saw, you know, staff in an Nair and Bevan, everybody from execs to porters saw research on the television, understood maybe for the first time the value of research, and its profile across the organisation has really grown. And so if you say now that you're from the research department, it's like, oh, we understand, yes, how can we help you? Whereas, you know, I suppose many of us have had that experience. We also have to almost apologetic for doing research in an organisation because we put people out. You know, I think everybody across the organisation, from patients and visitors through to, you know, to all of the staff from the execs through to porters and admin staff, really understand that research is what's going to get us out of this COVID fix. And I think we have to build on that in terms of learning lessons. You know, when we one day move out of, you know, and we've learned to live with COVID and we're doing maybe other types of research, then I think that, as Anna said, those relationships will stay with us forever now. We're building them, and there are, I think, many more positives than there are negatives, although it's been, for everybody in Wales and those people who've joined us from outside Wales, it's been really hard graft, but it's all been worth it. We have the next slide. So we're hoping that we'll be able to get into some discussion now, and we can't see your questions, but I know that the Kate is going to be telling us what those questions are. So we think that it's really important, as we said, to recognise every individual within the team has got a role to play. Staff that we had, some of our admin staff that we thought, oh yeah, they're fine doing that job, have come out and worked really way over and above what we ever thought they would. And we are quite open-minded. We just gave them the space to, well, if you think you can do this, have a go. And they've really, really come up trumps. So people have developed massively. They've grown and evolved massively. Understanding, say, where we're trying to get to in the bigger picture. And I think our role within helping to get national and international solutions. We've really been able to have reflective working where we've just had to take time out from time to time and think about what we're doing. And we've all got each other's backs. And I think, Anna, as Anna said, it's really important when you're in these situations. We could only make the decisions we could make at the time based on the best information that we had. We may not have got things right all the time, but I don't think people could have made better decisions. And it's been really sort of hard, some of the stuff that we've had to stop and some of the stuff that we've decided to prioritize instead. And we've had those really challenging conversations about, we've been really challenging with each other about why would we do this and not that. So we want to sort of if we can we'll invite some questions.
Hi everyone, I'm going to see if I can get the thumbs up from the tech crew, but I now have Anna and Sue on my phone talking to me. Anna, Sue, do you want to say hello? And I'll see if... Tech crew, can you hear them? Good. Rob, can you give me... Yeah, okay. So we do have some questions here. We have a question from Liz. If you had staff working in trials but hadn't ever worked in this environment before, what did you do about GCP training requirements?
They had to do GCP. So for something like the recovery trial, they didn't stipulate on this study that they had to have GCP. But what we did try and do, because we had staff that were working in areas that didn't do research before, I did want them to do GCP. And it can be done online, and we just help support them with that. It can be done quite quickly. But I did think it was an important part of it, because they did no research before, and it had to be done. So
it's got on with it. Yeah. I think all did it. I think because we've got experienced research nurses who were supporting them, that they were able to understand the key things and the key sort of risks that there might have been. So we were very conscious of safety whilst helping people to get sort of skilled up. And it wasn't just sort of like nursing staff. We had, medical staff as well, and some of the therapy staff and lab staff that were helping out on some of these studies as well. Does that answer the question, Liz?
Yeah, it's just that you have to make sure during these times that even though we were doing things rapidly, we still had to make sure we was maintaining patient safety. And I think that is sometimes it would be easy to forget that you just want to open these trials, you just want to get people on it.
We're back.
Oh,
1%, we're back.
So so patient safety still was paramount throughout it all.
That's brilliant. Liz says thanks, so it looks like you have answered her question. Thanks. Okay. So we have another question from Harry Neese. Who and how were patients chosen for the vaccination trials?
So these weren't patients, they were frontline workers. So there was Oxford University set each of the 18 sites up with its own part of their website. So participants who were interested went onto the Oxford Vaccine Trial website and registered their interest there. Now, there were a number of sort of like screening processes they had to go through. So we had participants, everybody wanted to help. We had participants who were applying, but they'd already had COVID or they'd had symptoms of COVID. They weren't allowed to come into the trial. We had people who didn't have exposure, and one of the requirements for the study was that participants had to have exposure to coronavirus, and by nature of their work. We did have, so that's how participants were invited in, and then from then they came in, if they looked eligible, they then came in for a screening visit, and from that screening they went through the normal process then.
Okay, thanks, Sue. Hopefully that's answered Harry's question. Yep, he's just said some brave participants, thanks. A question here from Abigail Taylor. Have you reopened all of your non-COVID trials?
So no, we haven't opened all of our non-COVID trials. So what we did a restart program where we would look at, examine what studies we could reopen individually, and just making sure that the pathways are right, that we could run them. So the most difficult thing we had, so in an Iron Bevan, I don't know if anybody knows the background, but as well as having COVID, we've also got our clinical futures programs, because we have a new critical care hospital opening, which we're going to start moving some departments to in November. So what the health board did as a whole when COVID happened is they moved some patient pathways in some departments, and that hasn't gone back to normal. So for example, surgery patients, so we've got quite a few surgical studies that we had on our portfolio before COVID, but post-COVID we haven't yet been able to reopen those because those pathways have completely changed. Either the surgery's been done in a different hospital, or the patients might not be seen at pre-assessment like they were before, or that they suspended those types of surgery. So everything that we could reopen, we have, but there are still quite a few studies that we can't do just because of that pathway change. And that is one of the biggest challenges we got now. We haven't suspended studies yet. We have prioritized COVID again, but we've decided not to suspend, and we will just see how it goes. So my staff are currently trying to manage COVID alongside normal studies, which is a difficult ask, but they are managing it quite well, and we will just see if the COVID cases increase. We will then need to reassess that again.
Yeah, that's right. And I think that it's sort of trying to build a bit of sustainability in, because what we don't want to do is to restart studies that we'll have to suspend again. So it's about, well, does this look as if it's got, sort of legs to go right through another pandemic? And also I think, as we understand it, the rest of Wales, each organisation will get a vaccine trial at some point. So it's about trying to understand, if we're in follow-up phase now, thank goodness for the vaccine trial, but it still consumes a lot of resource, and that's not just an Iron Bevan resource, it's the wider community's resource. So, if you are restarting studies, will it impact? We've got like three elements. We've got the COVID trials, we've got the vaccine trial, and we've got the non-COVID trials, and we've got to sort of try and spin those three plates, which is no mean feat. Whilst we need to build in as well, we haven't really had many staff who've been off with COVID, whereas at the beginning we thought, oh well, if people get it, that's all right, because as long as we get it at a rate of 20% of the workforce going down with it, when they come back they'll be fine and they'll have immunity, and that won't be a problem. Of course, we know now that isn't the case, and so you also have to build in a little bit of extra if you do get sickness, and you do get people who have to shield and childcare issues and all the rest of it. We can't go as close to the wire as we might have in other times. We have to be a little bit cautious. We're not a cautious organisation, but we do have to build in some degree of caution. So I would say, in terms of like lessons learned, that is one of the things that we've learned. When you look at a team and you look at a rota and you look at who's going to be delivering, across the whole sort of 7 day a week working, you have to look at where your pinch points are and where your risks are, and have a plan to manage those.
Thanks, Sue.
Yeah.
We do have a comment here, and if anybody else has got any more questions, please add them. Gina has said the informal discussions and support are crucial. Really interesting to consider different roles and impact along the research pathway. Great team effort. So that's
I think that you know, when many of us were in, you know, having to come in the office or work from home, but very much part of this everyday frenetic activity. And it was almost like with our admin staff, they'd gone home with we'll get you your laptop, they were getting equipment, whatever. And we did really quickly realize we needed to support them. Because those staff felt so isolated, and they were staff we'd see every day, and they felt useless in many ways. We're not there, Sue, we're not helping you, we're not doing what we think we should be doing. And it's a pretty sort of horrible situation for anybody to be in. And so when you layer on top of that individuals, issues with parents, children, people being sick and what have you, the emotional support, we hope we've given our staff as a sufficient emotional support. And as I said, that trial, the ASARIC data entry sort of study really brought it home to me, the impact of entering data when the outcome was not good, was really sort of brought it home. And I was so glad that we sort of introduced that WhatsApp group. I mean, it is, that, you have a bit of a laugh on it as well, because, they're sort of saying, oh, we can't get into this, or this has happened, or, I'm doing this. And it's so good to feel that connection with people that you've known very well. And, you hear on the news, don't you? There's so much about, oh, why are we bothering opening these big offices and to run insurance companies or whatever it is, we don't need it. They could go. I think it's all very well. Home working is all very well if you know people well, and if you have got a good connection with people. I think the testing time will come is when we make new appointments and when we have new staff coming into the system. And how do you make those connections if you're not in the same room with them? I think is one of the challenges we've got moving forward. I mean, what we're doing with our staff that we're shielding is they're coming back in one day a week, because it isn't necessary for them, for their job to be in the office, but it's necessary for their mental health, and it's necessary for their connection and their teamwork, and to feel that they can be with other people, if socially distanced and whatever, but that they have still got a home. Because when we stripped the unit out to run the vaccine trial, people's desks went, people's personal stuff got packed up, and it's been sort of quite challenging for individuals to come back when they didn't know what was happening, and they were sort of feeling very much on the outside. I think moving into the second wave will be more experienced, and we would be happy to help anybody wherever they are if they were wanting to sort of think about this and how they do it. But a simple thing like a WhatsApp chat, a simple thing like having a Zoom meeting, a time where people can be a bit silly as well. Yes, it is a serious situation, but you do need to maintain those personal relationships and feel that you are still building a team and still functioning as a team.
And I think, we missed our last conclusion bit, really, that, as I said, we see the true nature of a team, and it's the darkest hour, and we've definitely done that. And I just wanted to end really on a little story, which if you all know it, about when President Kennedy was visiting NASA, and he was asking a janitor, what's your role in the team? And the janitor said, well, I'm putting a man on the moon, because that janitor realised that his little part in that organisation made sure that everybody could do what they could do. And that's the same with COVID trials. For every single person that's worked on a COVID trial or the vaccine study, for every single participant, they fed into the bigger picture of trying to find treatments and cures and a vaccine for COVID. I just want to thank everybody for that, staff and patients.
Yeah, and I think we, at a local level, we had one of our technicians who came in, and we needed a temperature probe for one of our fridges that bloods were going into, and we didn't have one. And Matt came along and he said, I'm going to see what I can do. And he went away and he came back a few hours later. He said, I've been home to get this from home. This is my own monitor. He said, this will be sufficient, he said, to get you until yours has come. And he said, and I've ordered one for you, and I'm going to take delivery of that, and I'm going to come and fit it. He said, because I understand how important these trials are and what you're doing. And, he sort of very much felt part of it.
Yeah.
And as we sort of said earlier, all the porters, all the cleaners, the kitchen staff who provided us with supplies, the procurement staff, the people who were coming delivering scrubs to us all understood how valuable the research we were doing was, understood that they all had a role to play in it, which is really important.
Oh, we're off again. I think that's fine.
No, you're still there. We can just see the light. Oh no. I think we've lost them again. They do have one more slide. Wonder if we can see the slide at the end. It's quite a good one. I think they're just coming. If they can. So. Yeah, we have lost them again. I think we're just showing this slide, but I think we'll just say thank you to both Anna and Sue for doing a brilliant job in trying circumstances. Thank you everybody for attending today. Don't forget